Ombudsmen are residential advocates that provide regular presence in long-term care facilities to ensure that residents' rights are not being violated. Ombudsmen empower residents to self-advocate and support resident councils to provide residents with an opportunity to express their concerns. Ombudsmen also partner with facility staff and leadership to help resolve issues that come up for residents. In Idaho, the Ombudsman Program operates under the umbrella of the Idaho Commission on Aging. Ombudsmen also provide education and training to resident staff and the community at large. And that's part of why we started this program, to provide resources and information related to issues that are affecting residents in long-term care facilities. The Long-Term Care Ombudsman Program is holding monthly statewide town hall meetings via Zoom, like this one, to discuss all concerns of residents in long-term care facilities. We meet the fourth Wednesday of the month from 3 to 3:30 Mountain Time, and it's open to anyone in Idaho. I just want to provide a confidentiality reminder. Please refrain from using the name of your facility of your loved one when asking questions. Do not name specific facilities. Please use the terms nursing home, assisted living, or personal care home to present to the group. If you need specific assistance, please use the chat feature to state the county that you are in, and we will have an ombudsman reach out to you. The calls have public access and are designed for family members as well as residents and friends of long-term care facilities. Virtual meeting tips. You have all been placed on mute upon entry. We will open the lines at the end so that you will be able to ask questions. If you would like to speak or have a question, please use the raise hand feature. Once we have completed our presentation, we will open the meeting to questions. The chat feature is at the bottom of your screen as well. Once you maximize it, you will be allowed to ask questions or put questions in the chat. For any complaints or questions, please reach out to the State Ombudsman Office. And now I will hand it over to Sherry, who is our moderator and will be our presenter today as well.
As to present today, we hope you will find today's presentation provides valuable information on locating a long-term care facility. My name is Sherry Young. My role is Family Counsel and Volunteer Coordinator with the State of Idaho Long-Term Care Ombudsman Program. I am honored to present today. So with that said, let's get started. Today's agenda. We believe that the first best choice for any individual would be to age in place at home. There are at-home nutritional programs as well as many others. Your local Commission on Aging can assist you with resources. Reach out to your primary provider or your local AAA for support for caregivers. But if all other resources have been exhausted, long-term care may be the direction you need to take. In today's discussion, we will explore the appropriate timing for considering a facility, the various types of facilities available, methods for locating a facility, key factors to evaluate when selecting a facility, and finally, the process of applying for Medicaid. Staying in your own home as you get older is called aging in place. There is a network of agencies and organizations that specialize in helping seniors live in the residence of their choice in the community. These resources can be found on the Idaho Commission on Aging website. They include home-delivered meals, supplemental food, family caregiver support, transportation, senior employment, Medicare education, homemakers, and caregiver respite. When is it time to consider a long-term care facility? Numerous factors may influence your decision to conclude that relocating to a long-term care facility is the most beneficial option for you. When an older person needs more help than a family member or friend can provide, it may be time to consider moving to a residential live-in facility, such as an assisted living or a nursing home. Choosing a place to live for long-term care is a big decision. It can be hard to know where to start. Some factors are worsening medical conditions, monetary issues, isolation, untidy living conditions, and poor hygiene. Over 70 million individuals aged 50 and above are affected by at least one chronic medical condition, which may include serious ailments such as Alzheimer's disease or heart disease. As these seniors age, their need for medical care intensifies, and their ability to manage daily activities diminishes. In addition to chronic illnesses, the likelihood of experiencing medical emergencies escalates with advancing age. If a senior family member reports having fallen and having difficulty rising on multiple occasions, it may be an indication that living independently is no longer safe for them. Approximately 1/3 of seniors experience at least one fall each year. The mortality rate associated with falls has consistently increased over the last 10 years. Financial challenges. Elderly individuals may find it increasingly difficult to manage their financial obligations. Conditions such as dementia can impair capacity for abstract thinking and complicate numerical comprehension. Additionally, seniors may be particularly vulnerable to financial fraud, whether perpetrated by telemarketers or even their own relatives. Such scams can lead to severe financial distress, hindering their ability to care for themselves, regardless of whether they reside independently or in assisted living. Untidy living space and poor hygiene. A disorganized and malodorous living environment may suggest that a senior individual is no longer capable of independent living. This situation can often be attributed to a decline in their physical ability to maintain cleanliness, leading to difficulties in performing tasks such as vacuuming or washing dishes, or even placing dishes in the dishwasher. Additionally, it's crucial to assess the dietary habits of your loved one. Examine the contents of the refrigerator. Are there numerous items that have surpassed their expiration dates? Many food items that appear to be inedible? These observations may indicate that your loved one is unable to prepare a meal for themselves and or not consuming nutritious or complete meals, which can contribute to overall health deterioration. Although a loved one may retain some capacity for self-care, a significant indicator that it might be time to consider assisted living is a noticeable lack of motivation to engage in such activities. Signs of inadequate hygiene may manifest as infrequent bathing or neglecting laundry. Isolation. Senior isolation represents a significant concern. According to the U.S. Census, over 11 million seniors reside alone. This isolation can have detrimental effects on their overall well-being. When seniors withdraw from social activities, they tend to engage less in their hobbies, limit interactions with family and friends, and may refrain from leaving their homes altogether. Various health complications linked to isolation include heart disease and stroke, type 2 diabetes, depression and anxiety, suicidal thoughts and self-harm, dementia, and an increased risk of premature death. Now that we have looked at some of the indicators that might suggest a need for long-term care, let's look at the types of long-term care facilities. We will discuss 3 considerations for long-term care: certified family homes, assisted living, and nursing homes, also known as skilled nursing. To decide which one of these is the best fit can be challenging, but there are some tools to help you make a determination. Understanding your requirements for activities of daily living, also known as ADLs, is essential in identifying the appropriate level of care necessary for your situation. One way to measure the level of care a senior needs is through charting ADLs, which are activities of daily living: bathing, dressing, toileting, transferring, feeding. A number is assigned to each category: a 1 if you complete the task, or a 0 if you can't. Once that is done, you add up the numbers. The higher the score. If a senior scored a 5 out of 6 on the model, he or she has a relatively easy time completing basic functions of life. But if a senior scores a 1 or 2 out of 6, it's clear that he or she needs a lot of care and attentiveness, and then will need a type of senior care that is more hands-on. Once professionals measure ADLs, there are other types of more broad ways to gauge to get a deeper understanding. ADLs include activities like paying the bills, cleaning the house, cooking food for yourself, being able to transport yourself outside of the house, and socializing. These activities are measured in a similar fashion as ADLs, with numbers being assigned to specific activities. But because IADLs are far more expansive than ADLs, the number ranges are different. A certified family home is the one that meets approval criteria set by the state of Idaho and is certified by the Department of Health and Welfare to care between 1 and 4 adult residents who cannot live on their own. The focus is to provide care in a home-like, family-style atmosphere. I have included the link above for your reference. A CHF is a small, private facility. The rooms may be private or shared. Residents may receive personal care and meals, and round-the-clock staff. Nursing and medical are usually not offered. Assisted living care. Assisted living facilities are similar to nursing home in that there are 24-hour care, but usually residents in assisted living don't need as intrusive care as nursing home residents. Like nursing homes, residents in assisted living facilities are expected to be there for the long term, with an average resident staying for around 3 years. About 7 times more women than men live in nursing homes, but that's often attributed to the fact that women are expected to live longer than men. Those who enter assisted living facilities can often do many activities on their own, but not enough to where they can comfortably and safely live alone anymore. Residents usually have their own living space and are still allowed to socialize with other residents freely. Meals are provided to residents. Assisted living is for people who need help with daily but not skilled care, may have shared or single rooms with shared common areas, offers personal care, 3 daily meals, assistance with cares, medications, housekeeping, and laundry. They also offer 24-hour supervision, on-site staff, and activities.
Nursing homes feature round-the-clock assistance for residents who need highly attentive long-term care. The average resident who enters a nursing home is there for around 2.5 years. Seniors who reside in a nursing home usually have lower ADL and IADL scores. Most nursing home residents need help with bathing and help with getting dressed. Nursing homes require that a registered nurse be available, though nursing homes can have different levels of skilled nursing present. Usually, nursing home care isn't covered by Medicare. Skilled care is, however. Skilled care could be wound care, physical therapy, occupational therapy, or IV antibiotic care. Medicare doesn't cover custodial care if that is the only care that you need. Medicaid does. Services typically include 24-hour supervision, nursing care, 3 meals a day, and assistance with activities. Rehabilitation services such as physical, occupational, and speech are also usually available. I'm now going to turn this back over to the State Ombudsman, Fanny Melnikovsky. Fanny?
Thank you, Sherry. Yeah, so I'm going to share my screen and I'm going to walk you through the Certified Family Homes website, the Assisted Living website, and the Nursing Facility website on how to search for a facility. So I'm just going to share my screen. Okay. So we are looking at the Certified Family Home website on how to search for a facility. Once you click on the link, this is what you will find. And if you look here on the left, you will see that you can check off the type of care. You can select alternative care, hourly adult care, or ongoing care. And then you can also choose by location. And for the purpose of this presentation, I'm just going to type in the city of Eagle. And you have to click on this hourglass. And then you have to check it off. If you don't, it's not gonna, if you don't check this box, you will not be able to have a search here. It won't populate a search. So then if you scroll down, and you could see that it automatically brought up a list of facilities that are available in Eagle. So if you scroll down, you can also select by service type, and then you can also select optional services and check what you're looking for. And then if we scroll down some more, you're going to see this map here. And this map shows the location of current vacancies in Idaho. And then if you scroll further down, you can see that this website was last updated on September 24th, 2024. So it's pretty current. So now we're going to scroll back up, and you can see that the city is selected. You can also see the provider or owner information. And then you can also see the contact information, and you can see how many beds are authorized at this facility. And you can also see if they're occupied and how many vacancies. You can also see optional services they offer. So it's pretty easy and simple to use. If you're looking at multiple locations, you can hit this plus and then add another city and hit that hourglass, and whatever cities you're looking for, it'll populate a list for you. So it's pretty easy to use. Next, we are going to look at, let's see. So this is the website. It's called FLAIRS, Facility Licensing and Regulatory Enforcement System. And this is the website for how to search a facility, an assisted living facility. So you can select by facility name, address, city, zip, and I'm just going to type in here, let's see, we're going to do West Ada. I'm Ada County. So I'm just going to select Ada, and I'm not going to check on these, and I'm going to hit search. And this website takes a little bit longer. You can also see here that you can choose a memory care unit if you're looking for a secured unit for your loved one that has the tendency to wander. You can click on here and it'll give you those facilities. But right now we're just going to do a general search. And you can see it's still going. It takes a little bit longer on this website. And you can also see here, you can click on facilities that accept Medicaid, residents with that are developmentally disabled, someone with mental health illness. Okay, so the search is done. And if you scroll down, you can see here there are stars next to your list of facilities. If you see a gold star, that means Gold Excellence in Care Award. That means that no deficiencies were cited during the survey. And then some of them may have a Silver Award. The Silver Award means the Silver Excellence in Care Award. It means that no core deficiencies were found, but there were fewer non-core deficiencies cited during the survey. So if you scroll down, you can see here what star rating they got, name of the facility, their address, the city, phone number, number of beds available, who's the owner, if it's secured unit or not, heart beds, and license status. And really, when you do your search, we're providing you this information for you to plan ahead and do some research, visit facilities. Just because a facility has a gold star doesn't mean that it's going to be the best fit. It may be that, it's a facility that has residents that have dementia and don't socialize. And if you're looking for a facility that where your loved one can socialize and has a very active activity program, it may have a silver star, but that might be the best fit for you. So really do your research and try to visit the facilities and ask questions if possible. Another thing to look at is their survey, which is what we're going to we'll talk more about a little bit later. So now we're going to move on to nursing facilities. So when you click on the link we provide you, this is what the front page that's going to show up. And you can see here it looks completely different than the other two. This is by the Idaho Department of Health and Welfare, Licensing and Certification Department. And you can see this list is going to look a little bit different. It'll give you the total number of facilities in Idaho and how many beds are accepting Medicare only, how many beds or facilities are accepting Medicare and Medicaid. So if you scroll down, so you can see this is more of a list. So you just have to go down the list. It's not really in alphabetical order. It's ordered by region. So if you look here on the right side, it says region 1, 2, 3, 4, 5, and 6. So, but this list will give you the facility name, the address, the city, state, zip code, phone number, their fax, who's the administrator, how many beds. You may be looking for a smaller facility, and you can see this one, the second one has 24 beds, or size doesn't matter. There's a facility like this one has 124 beds. Oops, sorry. So just really, again, this information is for you to plan ahead and really do as much research as you can when you're looking for a facility. But I want to show you, if you scroll down to the bottom, you can narrow down your search by clicking on this link here. And it will take you to the Medicare.gov website, CMS, Centers for Medicare and Medicaid. And here, so if I enter here, let's say I entered, it'll automatically capture the location you're in. But if I enter, like just say the city of Boise, Idaho, and just click on that and just do a search, and you can see the list of the facilities in Idaho. And here you can again narrow it down. You can do it by, let's say, for example, star rating. So I'm looking all the facilities at facilities that have a 3, 4, and 5-star rating. And then you can see which facilities have a star rating of 3 and above. But again, really look for a facility that's going to fit the needs of your loved one when you're looking for a place. So that's it. I hope this was helpful. There are ombudsmen available to help you if you're going through this process and it's very confusing, or if you have questions. Please don't hesitate to reach out to your local ombudsman. If your loved one, if you want to move them to a different state, because that's where they have more family support, there are ombudsmen throughout the whole country, and we can share the information with you later as to how to locate an ombudsman in any state. So, yeah, that's it, and I'll hand it back over to Sherry.
Thank you, Fanny. Now that we have determined the level of care and the types of facilities, let's go ahead and take a look on how we get started. Get my screen for you. And just in case there's any confusion, we are out of state in San Francisco at a conference, and we've had to do a little switching of computers. So I'm going to show up as Fanny, and she's going to show up as Pamela. So just in case you happen to catch that, I thought I'd give a little explanation. All right, so let's get started on our search. First would be reach out to your local long-term care ombudsman. An ombudsman is an advocate for assisted living residents and a resource for consumers. The ombudsman will provide free information on the location and types of facilities, their strengths, special services, and any other long-term care information that you may be seeking answers for. There are ombudsmen in every state if you choose to move to another state or another area. Once you narrow down your list, select 3 or 4 facilities that are in your desired location. It is important to choose a location that's close to those who will regularly visit. See if they have an age requirement, if they serve a special population, and whether they offer the level of care required. Care levels vary greatly from residence to residence, so it is important to ask. If necessary, find out if they are handicap accessible or accept Medicaid. Find out first if the facility has openings. If they offer the services that you need, see if they are in your price range. The facility should be willing to show you around any time, but we suggest you make an appointment for the first time. Then if you like the facility, make a second, unannounced visit, preferably at a different time of day, such as a weekend or during an evening meal. Some general things to look for in the residence. There are some general things. Is the residence clean? Is it free from odors? Odors should not be persistent. Odors should not be persistent or pervasive. Ask to be shown a resident room, with resident permission, of course. Is the room clean? Comfortable? Is it home-like? Get permission to visit a resident bathroom, either in their room or a common bathroom. Is there space for toiletries and personal items? Are they stored appropriately? Does it have grab bars and an easily accessible shower? Are there clean towels and washcloths available? Do residents have access to a private telephone in a quiet place? Are areas available for private visits with friends and or family? Is there an area for private dining? Surveys. Become informed about the facility's management and administration. First and foremost, find out if the facility is licensed by the state of Idaho. Any facility providing care to 3 or more unrelated adults should be licensed by the state. If they are licensed, read the results of the most recent survey conducted by the state. This report provides details of any deficient practice found during the annual licensing inspection conducted by Licensing and Certification. Find out how long the current administrator has been there. If less than 1 year, ask how long the previous administrator was employed. Frequent changes in administration can affect continuity of care. Find out who owns the assisted living residence, and if there's a management company that's involved. Ask if there are other residences this person or company operates in the region. You may want to review the surveys for those residents as well to see if the person or company consistently provides good care. Surveys and complaints against assisted living residents are available for public viewing at the Ralph site listed. While you are on site, ask how complaints are addressed and how problems are resolved. Find out which staff person has been designated as the person to handle grievances. Lastly, if you have any questions on any of the information contained in this site, feel free to reach out to your local ombudsman for further clarification. This is a screenshot of what the survey page looks like. The facility name, town, survey type, the exit date of the survey, any deficiencies, and the license status are displayed. You will also find a list of administrators with their start and end date. Ideally, the same administrator should be at the facility for an extended period of time. In this example, you can see there were 4 administrators between April of 21 and December of 22. The current administrator has been there ever since. The nurses and owner's name are also shown. Any enforcements, survey types, and results and complaints are listed. You can drill down even further for more data. The Nursing Home Survey. The Bureau of Facility Standards provides surveys for nursing homes. There are some important data points to consider. Does the nursing home's inspection report show quality of care problems or other citations? Citations are failure to meet 1 or more state or federal requirements. Has the nursing home corrected all of the citations on its last state inspection report? If there is an issue at the nursing home that concerns you, ask them what they've done or what they are doing to correct it. Please note that the nursing home must make its most recent state or federal survey report available in a public place. That will tell you how well the nursing home meets the standards. Located on the Idaho Department of Health and Welfare are the nursing home surveys, which are available to the public. Similar to the assisted living survey page, the nursing home survey page shows the date and survey type. I'm not going to spend a lot of time going into the details, but I want you to be aware of the availability of the surveys for the nursing home facilities. These are important tools in your search for a home. Medicaid facilities. Medicaid is a health insurance program for low-income individuals of all ages. Medicaid pays for many non-medical supports and services that help frail seniors remain living in their homes. These are a few of the categories of Medicaid long-term care programs for which Idaho seniors may be eligible. 1. An institutional and nursing home Medicaid. That's anyone who meets the requirement will receive assistance. Benefits are provided only in nursing home facilities. 2. Medicaid waivers and HCBS, home and community-based services. There are a limited number of participant enrollment slots and waiting lists may exist. Benefits are intended to delay nursing home admissions and may be provided at home, adult foster care, adult daycare, or in an assisted living. And lastly, regular Medicaid aid to the aged, blind, and disabled, AABD. All eligible applicants are able to receive services. Various long-term care benefits such as personal care assistance or adult daycare may be available. On the MedicaidPlanningAssistant.org page, you can find the income and asset limits. There is also a page for locating nursing homes by city or zip code that accept Medicaid. I hope that this comprehensive presentation has given you all the tools you need to assist in the decision-making process for seeking long-term care. Please reach out to your local ombudsman for any help in the process. Note that all long-term care ombudsman services are absolutely free of charge. All of the previously mentioned links can be found on these 2 pages. This complete presentation will be made available on YouTube for future viewing. We have provided the QR codes and links for all sites previously discussed. These are some more of our links that we discussed. We do have one QR code that will give you the links to all of our Idaho Ombudsman sites. We have an ICOA Ombudsman program page, Facebook for Long-Term Care Ombudsman, Facebook page for our volunteer program. We would love to see you volunteer. We also have a Facebook page for our Family Council Connections, and then we have a YouTube page. This is our Ombudsman area coverage and contact information. We have 6 areas. We hope you enjoyed our presentation. Thank you so much for joining us today. We will now stop our recording and open the time for questions. You can use the chat feature or raise your hand. Please do follow us on Facebook, and remember, all of our presentations are uploaded to YouTube, so you can view them again when it's convenient. We will now open our lines for chat. Fanny, I'm going to hand this back over to you.
Thank you, Sherry, and thank you to our guests. I hope that you found this information valuable. Again, we are here to provide resources, and we hope that when you do have to find a facility for your loved one or friend, whoever you're looking for, that you take your time and you plan ahead. The best place for any individual is always in your home. That is the best place. But sometimes, as Sherry mentioned, there are times where you have to go to a facility, whether it's just for a short period of time for rehabilitation or for a longer period of time. So the best thing is to plan ahead, try to do tours in facilities and find the best fit for you. And we are here to help you along that process. So are there any questions we can help answer?